At this time, in multiple myeloma, the doctors and the patients are very happy because their life expectancy has dramatically improved as every new agent has been introduced. As you know, number of new agents have been introduced, 3 proteasome inhibitor, including one of them oral proteasome inhibitor, 3 immunomodulatory molecules, 2 monoclonal antibodies, and HDAC inhibitor, and so on and so forth. And we are actually sitting on a very robust pipeline. So some of the question that comes in is how to sequence them and how best to utilize them. In this ASCO meeting, as I said, one of the first cardinal rule is use 3 drug combination, immunomodulatory molecule, proteasome inhibitor, and a steroid, and that is very good. And then once they relapse, you have second generation immunomodulatory molecule, second generation proteasome inhibitor, as well as antibodies like daratumumab, elotuzumab were available for these patients. And then if they still progress, then there are a number of clinical trials are coming on. So sequencing is now slowly getting much more formalized, but at the same time, we are also some disruptive clinical trials are coming on where we are using monoclonal antibody on phase 3 clinical trial in newly diagnosed myeloma patient, seeing whether we can get more patient into deeper remission, molecular remission, and so on. But still, the take-home message is use 3 drug up front, and then once you relapse, you can combine the immuno-oncology as well as second and third generation immunomodulatory and proteasome inhibitor for the patient, and you can tailor the therapy according to the needs of the patient. And this is where, whether the patient has high risk or it is a good risk patient, slowly relapsing, actually giving lot more flexibility for the patient and physician. One more thing in myeloma is that we are now also segmenting the patients who are fit, patients who are intermediate fit, patients who are frail. We are now taking care of patients over the age of 80 years, patients with renal impairment, patients living far away, elderly patient having to travel to the treatment center. All of that also gives us flexibility how we want to use these different drugs which are available for us. So actually it is a good fit for us that we have the flexibility to tailor the therapy to their need while maintaining good response, also giving them productive and good quality of life. So there we are fortunate that we have several different treatment options available.